Kerrie and I work at Kerrie Practice. I've been here a year now as a practice nurse.
And I'm Heidi Hyde. I'm a current return to practice student, and I've been at Kerrie for a couple of years now.
I started in 2006 when I qualified, and I was on mostly surgical setting, working on the wards, and I was there for about 9 years, and then I stopped having my children. I was out for about 5 years, took a career break, and then after that 5 years COVID came about, and I decided to apply to do some vaccines, COVID vaccines, and a role come up here as a HCA, which I grabbed. Worked around family life, and I was here for 6 months at HCA running clinics, and then I was sort of gently persuaded to do my return, and that's when I started my return to practice.
For me, I qualified in 2001, and then I had a career break with 4 children, so I had about 14 years out, I think, in total. And then decided I really must get back into it because I loved nursing. So, but I wasn't quite sure how to get back into it. So there was a job vacancy here for phlebotomist, so I went for that. And then at the interview, our nurse manager said, well, actually, you can do your return to practice here. So that's how, okay, I sort of went back into it.
When I left nursing, I always made sure there was an avenue to get back into it because I always had a passion for it and I wanted to get back into it at some point. I just didn't know what capacity. I basically just googled it and found that Canterbury still offered that programme, and through the support of work here as well, my lead nurse helped me find out as much information, how it was going to be possible to sort of bow out of my HCA role and take on the student role as well. The Canterbury was really helpful in answering any questions I had. The programme director was brilliant at getting in touch and sort of getting me in the right pathway, really.
Me, I'd always known that you could do a return to practice, but I was unaware of that you could do it at GP surgery, because I'd always thought I'd have to go back into hospital and unsociable hours when you've got children. I thought I wasn't sure how I was going to do it, but like I said before, it was at the interview that she said, well, actually you can do it here, which was great because the hours are so much better with children, aren't they? And then obviously Kerrie having gone before me, I obviously got all the information off her, and my nurse manager sort of shifted me into the right direction.
Well, as soon as I started here as HCA, I realised how much I'd missed nursing, and I just had a drive really to get more responsibility and to further my career. Although I was a little bit reluctant with the practice nursing side, it's actually a really, really nice role to be in. Works around the family, it's perfect.
I absolutely loved nursing when I was a nurse, and you get to a point when your children are a bit older that you really want to get out and do it again. And then coming here, it's just great because I hadn't really considered practice nursing before, but realised what a varied role it is, and actually it's really interesting, the sort of things you cover that you don't cover on the wards, obviously.
Yeah.
So yeah, it's great to get back into it.
So it's sort of blended learning through Canterbury, because I did it partly during COVID. A lot of it was virtual, but it was only 1 day a week that we did virtual learning online, and then which was taught study days, and then in between times we had our directed study to complete, and then you do a sort of assessment at the end of it. We did visit the simulation suite and did a day's on our clinical skills, which was really good. And it gave us a chance to meet our colleagues and people that we were training with. And here's been fantastic. The support's amazing. I sort of made it quite clear that I wanted to be in practice nurse, and I think if the students wants to know which avenue they want to go down, I would recommend them sort of speak to the placement unit at Canterbury to see if they can get a place there. Because obviously, if the surgery wants to invest in you as a student, then it's a potential member of staff as well.
Yeah, very similar to Kerrie really, except because I'm still nearly finished anyway. There was less virtual, but about half and half. You do 12 weeks of theory, 1 day a week, and so we had half at home online and half at the uni, which was great because you got to know the other students as well and know what their sort of career path is and help each other out. And then, as Kerrie said, it's been great here. They've been very supportive of everything really, giving us time, giving us, patience for ourselves, and but support when we need it. You never feel stupid asking questions, do you?
It's been quite a slow progress, hasn't it?
Yeah.
It hasn't been, you sort of can consolidate those skills before you move on to the next bit, because there's so much training available, you can be a bit overwhelmed. A little bit apprehensive when I first started. It's just different, especially going from not working to being part-time in employment again. But the support again has been amazing. I don't think I could have done it without the support from my family, from my workplace. There's always someone to ask. In that sense, I think we've done really well to get into practice nursing, have such a lovely team, be part of such a lovely team. I think that the biggest thing for me has been the IT side from when I left, how it's all changed. I know there's lots of changes on the boards, so that hit hard quite badly when I started, but I think it's just once you start you progress.
Really excited to get back into it, to be honest. Slotting back in, and I just enjoyed the challenge of learning new things or trying to remember old things. Obviously with the IT, it was more the computer side of things that took a little while to sort of get used to. But they're very patient here, so actually it was easy to progress with that, wasn't it? You know, I hadn't done practice nursing, so that was a whole new area like wound care and things, which I didn't know a massive amount before from where I worked, so that's been great. Again, family really supportive, and if they hadn't been, I couldn't have done it. But my children can't shut me up now. They're, Mum, you're always talking about work.
But I would urge anyone to go back to it. It's a much needed, rewarding career. And I think when you find a niche that you're happy in, then you don't look back. It's just starting the ball rolling, I think. And if you get the right support network around you, then you're halfway there.
I think your family's got to be really behind you doing it, because obviously most people, it's possibly because they've had children. So if they're really supportive, you'll be able to do it basically. And just ask loads of questions from your placement people or, you know, the uni, and they're there to help you. So anything you're unsure of, and if you get a WhatsApp group or something with those at uni, you support each other that way as well. If you've done nursing, you can easily go back.
So anyone that wants to come back to nursing, that wants a real flexible position that they can work around family life, then practice nursing is really a good option. There's lots of specialities as a student when you come. There's so many different branches you can take. You wouldn't be bored because we'll send you off with community nurses. There's urology. We've got such a wide variety of specialists here.
Like wound care centre, and then there's social prescriber, so you go around people's homes and see how they are in their homes, which is actually really an eye-opener, isn't it? And sort of, because you realise how much you have to care for people holistically here and see how it's affecting them. And like with wound healing, you find out that they're not going to bed because they have the bed isn't suitable or they can't get upstairs, so it's all part of the holistic approach to patients.
We're quite proud to be returners, or soon to be, and we got rated outstanding, so obviously that's really proud.
They are a wonderful team here, really good, supportive and work really hard. I think they've got a good reputation in the community actually. A lot of other people said, oh yes, this is good surgery to me. So
yeah, although you're lone working, you never feel alone because it's a good team spirit here.